Welcome to Your Life Reset, a Virta Health podcast series. I'm your host, Teresa Link, and in this series, we'll hear from people on their Virta journey, the wins, failures, moments of adversity, and moments of joy they're experiencing along the way. So sit back, relax, and listen as we unwrap the truly human experience of Virta. Hey there, listeners. I'm Teresa Link, registered dietitian and content creator here at Virta, and this is Your Life Reset. In today's episode, we're diving into the fascinating world of continuous glucose monitors, known to most of us as CGMs. What they are, how they work, and who can benefit from using them. We'll also explore groundbreaking findings from a recent study and discuss how these results could influence the future of how and when we use CGMs. Joining us is the brilliant Dr. Caroline Roberts, endocrinologist and Virta's medical director of research. And she's here to share her expert insights. Well, great to see you, Dr. Roberts, and thanks for being here today.
Thank you.
So, Dr. Roberts, let's start by letting our listeners get to know you a little bit on a more personal level. So we've been colleagues for a long time now. What is it that you do here at Virta, and what inspired you to join the team nearly a decade ago?
So I was a general endocrinologist in private practice, and I made the switch to Virta in 2016 because I learned from a patient about how powerful very low carbohydrate nutrition was for diabetes. This was not something I had learned in my training, and my training was excellent training, but I didn't learn it there. I I was exposed to it through a patient, and my I made it my mission to um, help as many other people do this as possible, and Virta was the place to be to do that. The Virta's goal is to um, help millions and billions of people shift their metabolic health through low carb nutrition, and I thought that that's the right place for me. And then I have shifted over to the research team, so I'm predominantly on the research team at Virta, and I have a small patient panel as well.
And that's what we get to talk about today is the research and some exciting stuff that goes along with that. So before we talk about some of that research, um, in the first part of our episode today, we really want to talk all about CGMs because this research is really going to support some of that information we're going to be talking about, this conversation we're going to have. So since our episode is all about CGMs, um, again, these are all over the place right now. It seems like every commercial is either for a GLP-1 or it's for a CGM.
Yeah.
Pretty much everything I see on TV now. So again, it's all over the place. There's so many to choose from, and there's so many different reasons that they say CGMs could really work for you. So let's start with the basics. What are CGMs, and what do they do, just at a very basic level?
Yeah, yeah. So fundamentally, what they do is augment your ability to monitor your blood sugar. The typical way to monitor blood sugar is to use a small needle to get a little blood droplet from your finger, and you put that into a glucometer, and you get a reading. Now that reading shows your blood sugar right now, but it doesn't show you where it's been, and it doesn't show you where you're going. And you can't look at trends over time. So over the course of the day, what your pattern is. A CGM makes all of that possible. Now, the way a CGM works is that it is measuring the sugar levels not in the blood, but in the cells between the tissue of the skin. So it's just a little bit slightly different, but close enough. And it's something that you wear 24 hours a day, and it reads off your blood sugar every 5 to 15 minutes. I should say your sugar level every 5 to 15 minutes. And it'll show you a tracing. So it'll show you, this is where you are now. You came down from here. You're now heading down, or you're heading up, or something like that. And then if you've worn it multiple days, you can overlay those tracings and see what your daily pattern is, your circadian rhythm. Now, there are a few different ones on the market, and I imagine you'll wanna know a little bit more about them.
Yes, I do. Before we get there, you mentioned that it can let you know. when you're on the way down or let you know when maybe your blood sugar is on the way up? How on earth is
Yeah.
that possible?
So it'll I don't know exactly the details, but of course how it works on the algorithm side, but it'll see a trend like your this reading was higher than the last one, which was higher than the one before that and before that. And some of the
Okay.
sensors have the ability, there's an alarm, if especially if you're trending towards a danger zone, some of the sensors will be able to give what's called predictive alerts, like, hey, you're heading high now, or you're heading low now. And that could prompt a user to take action, to do something about it before they reach a more dangerous level of blood sugar. Now, not all the sensors do that, and so obviously picking the
Okay.
right sensor for your needs is a great thing to do, work with your provider on.
Yeah. So it sounds like there's some different types of sensors that could work for different people. Let's talk more about that. What are the different types that are available and how are they capable of really improving your health? Who might they be best for?
So there's two main types of sensors on the market, and by types I mean really how you wear them. So the main type that you probably see most of the ads for are ones where you wear it for 10 to maybe 15 days at a time, and then you remove the whole thing and throw it away. The way that those work is there is a little tiny filament, a flexible, like almost like a piece of thread, but it's a little, I think it's metal, a filament that gets placed under the skin, and then it sits there under the skin, sensing the sugar levels over time. On the outside, what you see on the outside, usually on the back of the arm, but some go on the abdomen, is the transmitter, and that's what's transmitting the data to your phone or to the reader that you might have with it. So that's what most sensors look like and how they function. There's one other type on the market, which is an implanted sensor. This is where a little device is planted underneath the skin, and it's used can be used for 6 months or a year. So there's two. There's a new one on the market that's good for a year. Now
Wow.
that thing sits under the skin, so there's nothing penetrating the skin. It's
Okay.
once it's there, it's healed up. It's good to go. Um, and what you then place over it, a transmitter. So the transmitter gets placed over it. That thing can be taken off for swimming or whatever you want to break, I suppose, from watching your blood sugars. And that's kind of unique. There's only one of those on the market right now. Now, in
Yeah,
terms of
that would be really exciting, I think, for a lot of users if they're not just using it to see what's going on maybe in 10 to 14 days, which I know I've heard of some people doing. They just kind of want to get a snapshot of what their, blood sugar looks like over the past 2 weeks or so and kind of make an assessment from there. But if you need to
Mhm.
use it every single day,
Right.
and also it's correct me if I'm wrong, it wouldn't be sticking out from the skin as much, right? Because you've kind of got this patch over the
Um,
top.
the patch is, I've seen them. They sort of look like a flattish pebble, like
Okay.
maybe the kind of one you'd pick up to skip. It's kind of a flat pebble, and it
Okay.
gets attached to the skin. So I'm not sure how much it sticks out from the skin. It would be visible, though. It would absolutely be
Okay.
visible.
And you said that I'm seeing a lot more folks wearing them on the back of the arm, and I feel like I
Hmm.
never used to see that before.
Right.
If I had a friend who had, had diabetes, they would usually show it to me on their belly. And
Yeah.
so has this changed? Have we just found out
It
that
is.
actually it's okay in either location?
It shifted, and I believe Libre was the company, or Abbott, who makes the Libre sensor. Their Libre sensor was only approved for use on the arm, and so,
Okay.
whereas, Dexcom could be on the abdomen or other areas, and so I think the trend seems to be towards putting it on the arm.
Okay. Okay. That makes sense. So there's some really cool things about CGMs, and it seems like there's some ability for them to be very helpful. What ways what ways are people noticing that they're able to improve their health if they do wear a
Yeah.
CGM?
Yeah, I think it's really interesting. I think that what it offers that finger stick monitoring can't provide is a really clear window into what foods do, what activities do. stress might do to your blood sugars, and to the degree that you're able to change that, like shape your food differently, get better sleep, use exercise to bring down blood sugars if that's what it does for you consistently. I think it gives the user, the patient, an ability to start having insights that really would be difficult to get otherwise.
Yeah, that makes a lot of sense. Okay. So thanks for explaining that. It sounds like there are some folks that this could be very beneficial for.
Mhm.
And I'm kind of getting the vibe that maybe we should all be using CGMs, but I don't know. Perhaps not. Perhaps there's more to this. So, earlier I mentioned that there's some new research that could potentially change the way that we think about CGMs and how they're best used, who they're maybe best for, who should consider using one. All those questions I think are we can answer with this research. Um, Let me ask you, on part of this research team here at Verta, what question were you trying to answer by doing this study?
Yeah, that's a great question. So, what we know, so first of all, just the progression of CGM use as they were developed and introduced to the market was primarily at first for people with type 1 diabetes. And that's a form of diabetes where the rule is really blood sugars are tough to control, that you really want to, you're at risk for low blood sugars and high blood sugars, but lows are particularly bad, and you really would like to know about them ahead of time if possible. So they were really developed for that group in mind and have been they've revolutionized care as far as I'm concerned. And now, just as a quick aside, they're connected to pumps. So insulin pumps can change insulin delivery based on the reading that's happening right now and the trends happening right now. So that's where CGMs got their start. Now they then started to expand indications into people with type 2 diabetes and anyone on insulin, and to people who have problematic low blood sugars.
For the purpose of doing this study, what question is it that you were trying to find the answer to?
So what we were curious in is we know that when people with type 2 diabetes are given a sensor or a CGM to watch their blood sugars with, as opposed to, the usual methods that they're using, they have improvement in their A1C, an improvement in their time in range. Now, time in range is a metric you can only get from a sensor, and it shows what percentage of the time you spend in the goal range. So we see that people do so. I mean, the bottom line is people with type 2 diabetes on insulin do a little bit better when they're using a CGM than when they're not. And the magnitude of that difference is about 10% improvement on time and range, 10% less time spent above range, and an A1C improvement of about maybe zero point 0.3 to zero point 0.4 down from the group with usual monitoring. So we thought, well, what about for our patients with type 2 diabetes who are enrolling in our care and following our nutritional guidance? Would it give them also a little bit of an advantage over people who are following our usual monitoring method, which is finger stick monitoring?
Okay, so let me make sure I understand. Um, Kind of in the wild, people with type 2 diabetes wearing a CGM seem to have more time in range, so better glucose outcomes, um, than folks who are not using a CGM. And then let's take it to our nutritional
Exactly.
protocol and
Right.
see if that still stands.
Yeah, or just like, I mean, should we be giving CGM to all our patients because it gives them a greater leg up on their
Okay.
diabetes control? I mean, um, would it be helpful to give CGM to Verta patients? That's what we really wanted to know.
Okay.
Does it help them make diet changes more easily? Does it help them do better? That's because that's what we see in people with type 2 diabetes.
Okay, so that is the question. I'm excited
Mhm.
to find out really what happened with this study. So let's talk about the results. What we know from the paper is that both groups, those who were using CGMs on the Virta nutritional protocol and those who were not were both successful with improving their health markers, right?
Yes. Yep.
Blood glucose, weight loss. And they were doing that again, both groups by adhering to Virta's nutritional protocol.
Right.
Is that an accurate thing to say about the result of this study?
Yes, yes, exactly. So what we
Okay,
did was we looked at baseline, how they were doing before they started diet changes, and then we looked at how they did after diet changes. And what we found was that and we were expecting the CGM group to do a little bit better because that's what we see in other
right.
circumstances. But what we saw was that both groups did exactly the same and they both did great. So they both saw tremendous improvements in their time in range and in their A1C and in weight. And the two groups were indistinguishable from each other in terms of the improvements that they saw. So both
Wow.
groups crushed it basically.
Okay. Both groups crushed it.
Uh-huh.
So is it that they crushed it because the way that they were changing their food intake was indeed the most powerful factor?
That is, I think that that's the logical conclusion. Yes.
Okay.
And so for me, this is really exciting because, first of all, it means, giving new Verta patients CGMs, it's not really needed. It's not really needed. We expect them to do exceptionally well because that's the rule rather than the exception. Um, now, it doesn't answer other questions like, well, what if there's one particular person who's struggling? Could they benefit? This is looking at a group. We took a group that, had uncontrolled diabetes. They were planning to do our nutrition, and we just changed their monitoring method. And both groups did well. And so I think there's room for CGM use in someone who's really struggling with it, who's maybe having trouble putting together the how to bring the nutrition plan into their life, understanding how certain foods affect their blood sugars differently than other foods. That is absolutely a possibility. And one thing that we've talked about is what about doing a study with CGM versus finger stick monitoring a little bit later in the game? Maybe
Mm-hmm.
the novelty of diet changes was equal for both groups because these were people, remember, first starting Virta for the first few months. Maybe a year in or after, the novelty's worn off and they may be, facing some new challenges with maintaining this way of eating. Maybe it would be helpful in those settings a little bit
Yeah.
later when.
Yeah. Well, looking forward to seeing that in the future. Again, it's another question that we can ask. Um, could using CGMs be more helpful longer down the road if there's a little bit of change in terms of strict adherence to a low carbohydrate lifestyle? If certain folks are integrating foods that maybe they hadn't before, is there gonna be a change there? And in those cases, is, are is using a CGM maybe gonna be more beneficial at that time?
Yeah.
Yeah, that's another great question that I'm sure we'll be able to find the answer for in future research. So you asked a question, should we be giving members CGMs, more members CGMs, right? And it sounds like you found the answer, which is we really don't need to. Because the dietary protocol was the most powerful factor here. I want to go back into kind of the middle because chances are there's going to be folks that have a lot of questions about things that you learned and things that you observed. So,
Mhm.
what did you learn about how the study participants were eating?
Yeah, this is so interesting. So, the principal investigator of the study is Holly Willis, and she is a dietitian as a PhD as well. And I'm so glad that she really wanted to make sure that we gather nutrition information from these patients.
Yeah.
So I'm so grateful that she pushed for this because what we learned was just so unexpected to me. What we learned was that, first of all, we got baseline data on everyone, so how they were eating before diet changes, and then on a few different time points in follow up. one thing that we learned that I thought was super interesting is that um, the ketogenic diet and low carb nutrition is often feared because it's considered to be a high fat diet or a high saturated fat diet and a high
Yeah.
protein diet. And the protein intake may be controversial for people with other, medical problems where maybe they need to not avoid high protein. But what we found out is that the fat, saturated fat, and protein intake didn't change at all. It's not a high fat diet. It just isn't. The intake stayed completely flat. The only
So
thing that changed was the carbohydrate intake.
so that's really interesting. Let me make sure I understand. So I am a study participant. Let's pretend I'm eating a certain way, a certain amount of carbohydrate, a certain amount of protein, a certain amount of fat, and then I join this study, and I adopt this low carb ketogenic protocol, and the amount of fat and protein on average stayed the same. Is that what I'm hearing?
Yes. Yep.
Okay.
Yeah. Stayed the
That is
same from
interesting because, yeah,
baseline to follow-up.
I think a lot of people really would fear it, like you said, really do fear that, like, "Oh, all of a sudden I'm
Oh,
eating all of this fat, all of this protein," and it
oh.
sounds like that just wasn't the case.
It is called that throughout the literature, a high fat diet everywhere. And to be honest, I never questioned it. I never questioned it. But now seeing this data, like, well, at least the way that Verta teaches our patients, our members to eat, it is not a high fat diet. It just isn't. The fat stays the same. Now, the percentage of fat, of calories from fat goes up because the total calories go down. So the absolute intake stays the same. It's a flat
Interesting.
line. Yeah.
And to clarify too, I think, a high fat diet, eating a lot of fat and also your body getting energy from fat are not necessarily the same, right? If
Right.
we open up the gates to our bodies being able to actually utilize our body fat for fuel, then we're burning fat for fuel, but maybe not that doesn't mean you have to eat tons and tons of fat. So I feel like that can be kind of a confusing aspect where when we say high fat diet, it's well, maybe it I'm not sure what we should call it, but the body is really utilizing more fat for fuel, but that can be from our internal stores and not necessarily what we're eating. Okay, interesting.
Absolutely. And
So we
and
can
I
we
think
can
that
put that fear to bed then.
I think so, yes. I mean, at least the way we teach it. There's other diets that are low carb and ketogenic diets that may not fit this profile, but the way that we are teaching it and the way our patients are implementing it, I mean, we provide advice to them and then they go implement it. And that's what they are doing. And I thought that was really
Okay.
exciting to see. There are so many caricatures out there of, people eating bacon all day long and gnawing on sticks of butter, for snacks,
Right.
and that just isn't true. It just isn't true. Um, that would probably be a very high fat diet. The way
Right.
that they are implementing it, it does not meet that. Now, another really exciting thing that we learned is that if you take, you have a pie, I guess, or you have the total number of calories or intake per day, and you simply reduce the carbohydrate. So that part shrinks. The rest of everything else stays the same. That means that the total calorie intake went down. Now, calorie restricted diets are really hard to follow long term because you have a compensatory hunger response. You may do okay for a little while, but then you're really hungry and sort of thinking about food all the time. And this is your body
Yeah.
trying to maintain itself through a famine or something like that. It's increasing your drive to seek food. But on a ketogenic diet, so by the way, at Verta, we don't tell people to restrict calories. We tell them to eat as much as they want on the ketogenic diet. So these people restricted their calories. So their caloric intake went down by about 600 to 800 calories per day. And they maintained that through their study. That's extraordinary.
600 to 8 6 to 800 calories a day. You said they
Yes.
restricted. Did they do this purposefully?
Well, we were very consistent in our, guidance. Eat to satiety. Here are the
Okay.
principles. Eat, aim for less than 30 grams of carbs per day, a little bit more for vegetarians for sure. Here's how much protein to eat. Five servings of non-starchy vegetables. Fat to satiety. Now the fat typically comes along with the other things. It's not the piles of butter. It's not gnawing on, the bacon bowl every day. You know, so but so the fat ends up being mixed in with everything else. And we said, eat however much you like. Eat until you're done. And they ate less. And
Yeah.
this
And
is this is this is backed by the literature on ketogenic diet. So it's not just something
mhm.
that we saw. We People report less hunger, um, feeling more full, feeling more satiated. So it's sort of like it makes calorie restriction easy. And in fact, in a lot of studies where
Uh-huh.
they're comparing ketogenic diet to other diets, they will have the other diet specifically be a calorie reduced diet because they know that the ketogenic diet group is going to be reducing calories on their own. So it was fun to see it in our patients in the wild, where we weren't telling them exactly what you were giving them principles and helping them navigate those decisions and how to implement it. But it was really interesting to see them do this on their own with specific instructions to eat as much as they want.
And just to reiterate the point, you did say that the participants weren't just eating fewer calories in the short term, right? This had sustained for some time beyond
Oh yeah,
the time that most people would want to give up from feeling super deprived on a low
the
calorie
The
diet.
length of the study, yeah.
Okay.
For as
Oh,
long as
wow.
we were measuring
Okay.
it, they continued it, yeah, months.
Okay.
So really, really cool to see, really cool to see.
Yeah. Yeah. Okay. So it sounded like you guys learned a lot. Sounds
Mhm.
like you were able to get some pretty important questions answered. Okay, so Dr. Roberts, it sounds like there was a lot of really helpful information that you learned by doing this study, by conducting this research. So just to recap, what did you conclude about CGMs after the study?
So the conclusion is not that CGMs have no use. The conclusion is that in the setting of making this dietary shift, it may be superfluous to use a CGM. And I think that really it's not that CGMs have no benefit. That it's established that they're great. It's just that the benefit of this way of eating overwhelms the benefit of the CGM. We couldn't see the benefit of the CGM in this setting because the other improvements were so powerful. I use CGM all the time in Verta patients, especially when they're struggling, when we really need to see what's going on with a little bit more detail in their daily blood sugar patterns. I think they're wonderful. And I do think there's a role for them. I just think that for Verta, it's not you don't need this to get off to a galloping great start. You really don't need the extra device, the extra copay, the extra monitoring. It's not needed.
So while there's a lot of benefit and a lot of cool technology that can really help us out with CGMs, the true power is really in what we're eating.
Absolutely. Absolutely.
Okay.
Yeah, and that's exciting because, we all go to the grocery store, we all get food, we're all eating, and so it's within that realm of things that we're all already doing. That's where the power lies, and that puts it within reach of everybody, the insured and the underinsured. You don't need this extra device to bring your health to a better spot. It's within everybody's reach.
I think that's a really great message to end on is really a hopeful message that no matter who you are, you can improve your health. You don't have to have a CGM in order to do that. While it can be helpful, really again, it's what we're shopping for at the grocery store.
Yeah.
It's by these everyday activities of choosing foods and really that holding the key to to having the best health benefits. So thank you, Dr. Roberts, so much for being on today and for sharing this really powerful research. And it sounds like it's something that we're going to be able to perhaps utilize in terms of shaping how we treat diabetes, which is something we're already doing and on a mission to really do. So thank you so much again, and it was a pleasure to have you on.
Great to be here. Nice talking with you.
If you enjoyed this episode, be sure to subscribe and leave us a review on Apple or Spotify. And if you'd like to regain control of your metabolic health and feel like yourself again, check us out at Virta.com. That's VIRTA.com. Your Life Reset is for informational purposes only and shouldn't be considered a substitute for professional medical advice, diagnosis, or treatment. Contact your provider if you suspect you have a medical problem. I'll chat with you all again soon. Until then, stay inspired, my friends.